Hi everyone, I am Annalyn Tigo and today I will tackle about the female reproductive system. So, the reproductive role of the female is much more complex than that of the male. Not only she produces the female gametes or the ova, but her body must also nurture and protect a developing fetus during 9 months of pregnancy. Like the testes, ovaries produce both exocrine product, the eggs or the ova, and the endocrine products like estrogen and progesterone. The other organs of female reproductive system serve as accessory structures to transport, nurture, or otherwise serve the needs of the reproductive cells and or the developing fetus. So, the ovaries are the paired Ovaries are pretty much the shape of almonds but are nearly twice as large. An internal view of an ovary reveals many tiny sac-like structures called ovarian follicles. So each follicle consists of an immature egg called oocytes, surrounded by one or more layers of very different cells called follicle cells. As a developing egg within a follicle begins to ripen or mature, the follicle enlarges and develop a fluid-filled central region called an antrum. At this stage, the follicle called a vesicular follicle or Graafian follicle is mature and the developing egg is ready to ejected from the ovary, an event called ovulation. So after ovulation, the ruptured follicle is transformed into a very different looking structure called corpus luteum, a yellow body which eventually degenerates. Ovulation generally occurs every 28 days, but it can occur more or less frequently in some women. The ovaries flank in the uterus laterally. These organs are secured to the lateral walls of pelvis by suspensory ligaments and are anchored to the uterus medially by the ovarian ligaments. In between, they are enclosed and held in place by a fold of peritoneum, the broad ligament. So, duct system. Duct system, the uterine tubes, uterus, and vagina form a duct system of a female reproductive tract. So, uterine tubes, the uterine tubes or fallopian tubes form the initial part of the duct system. They receive the ovulated oocytes or provide a site where fertilization can occur. Each the uterine tubes is about 10 centimeters or 4 inches long and extends medially from an ovary to empty into the superior region of the uterus. Like ovaries, the uterine tubes are enclosed and supported by the broad ligament. Unlike in the male duct system, which is continuous with the tubule system of the testes, there is little or no actual contact between the uterine tubes and the ovaries. The distal end of each uterine tube expands as the funnel shape in fundibulum, which is finger-like projections called fembrae that partially surrounded the ovary. As an oocyte is expelled from an ovary during ovulation, the waving fembrae create fluid currents that carry the oocyte into the uterine tubes, where it begins its journey toward the uterus. Many potential eggs, however, are lost in peritoneal cavity. The oocyte is carried toward the uterus by combination of perithalsis and rhythmic beating of cilia. Because the journey to the uterus takes 3 to 4 days and the oocyte is viable for most 24 hours. After ovulation, the usual site of fertilization is the uterine tube. To reach the oocyte, the sperm must swim upward through the vagina and uterus to reach the uterine tubes because they must swim against the downward current created by the cilia. It is rather like swimming against the tide. So, the uterus. The uterus, located in the pelvis between the urinary bladder and the rectum, is a hollow organ that functions to receive, retain, and nourish a fertilized egg in a woman who has never been pregnant. It is about the size and shape of a pear. During pregnancy, the uterus increases tremendously in size, and during the later part of pregnancy can be felt and well above the umbilicus. The uterus is suspended in the pelvis by the broad ligament and anchored anteriorly and posteriorly by the round ligaments and uterosacral ligaments. So the major portion of the uterus referred as the body, its rounded region superior to the entrance of uterine tubes is the fundus, and its narrow outlets which protrudes inferiorly into the vagina is cervix. So here, the thick wall of uterus is composed of three layers. The inner layer, the wait, or mucosa is the endometrium. If fertilization occurs, the fertilized egg, actually young embryo, by the time it reaches the uterus, burrows into the endometrium, a process called implantation, and resists therefore the rest of its development. When a woman is not pregnant, the endometrial lining sloughs off periodically, usually about every 28 days. In response to the changes in the levels of ovarian hormones in the blood, this process, called menstruation or menses, is often referred to as a woman getting her period. So the bulky layer of the uterus wall is the myometrium, which compose of interlacing bundles of smooth muscle. The myometrium plays an active role during childbirth. When it contracts rhythmically to force the baby out of the mother's body, the outermost serous layer of the uterus wall is perimetrium, or the visceral peritoneum. So, vagina. The vagina is a thin-walled tube, 8 to 10 centimeter or 3 to 4 inches long. It lies between the bladder and the rectum and extends from the cervix to the body exterior, often called the birth canal. The vagina provides a passageway for the delivery of an infant and for the menstrual flow to leave the body. Because it receives the penis and semen during sexual intercourse. It is the female organ or copulation. The distal end of the vagina is partially closed by a thin fold of mucosa called hymen. The hymen is very vascular, to tends to bleed when it's ruptured during the first sexual intercourse. However, its durability varies. In some women, it is turn during a sports activity, tampon insertion, or pelvic examination. Occasionally, it is so tough that it must be ruptured surgically if intercourse is to occur. So, the external genitalia and female perineum. The female reproductive structures that are located external to the vagina are the external genitalia. The external genitalia, also called the vulva, include the mons pubis, labia, clitoris, urethral and vaginal orifices, and greater vestibular glands. So the mons pubis, or mountain of the pubis, is a fatty rounded area overlying the pubic symphysis. After puberty, this area is covered with pubic hair. Running posteriorly from the mons pubis are two elongated, hair-covered skin folds, the labia majora, so which enclose to delicate free folds. The labia minora, the labia majora enclose a region called the vestibule, which contains the external openings of the urethra, followed posteriorly by that of the vagina. Just anterior to the vestibule is the clitoris, a small protruding structure that corresponds to the male penis. Like the penis, it is hooded by a prepuce and is composed of sensitive erectile tissue that becomes swollen with blood during sexual excitement. The clitoris differs from the penis in that it lacks a reproductive duct. A pair of mucus-producing glands are the greater vestibular glands. Flank the vagina, one of each side. Their secretion lubricates the distal end of vagina during intercourse. The diamond-shaped region between the anterior end of the labial folds, the anus posteriorly, and the ischial tuberosities laterally in the perineum. So the female reproductive functions and cycles. Although sperm production in men continues throughout life, the production of eggs in women is quite different. The total supply of eggs that a female can release is already determined by the time she is born. In addition, a female's reproductive ability, that is, her ability to release eggs, begins during puberty, heralded by a beginning of her menstrual cycle, and usually ends in her 50s. The period in which woman's meiosis, uh, reproductive capability ends is called menopause. So unlike the male urethra, which carries both urine and semen, the female urethra has no reproductive function. It is strictly a passageway for urine. So, the oogenesis and the ovarian cycle. Meiosis is the special kind of cell division that occurs in the testes to produce sperm. It is also occurs in the ovaries, but in this case, ova or female gametes are produced and the process is called oogenesis. The beginning of an egg, this process is shown in this. This is the process of the oogenesis or the ovarian cycle. So, in developing female fetus, oogonia, the female stem cells multiply rapidly to increase their number, producing daughter cells called primary oocytes. These primary oocytes then push into the ovary connective tissue where they become surrounded by a single layer of cells to ultimately form the primary follicles. By birth, the oogonia no longer exists, and the female's lifetime supply of primary oocytes, approximately 1 million of them, is already in place and in the ovarian follicles, awaiting the chance to undergo meiosis to produce functional eggs. Because the primary oocytes remain in this state of suspended animation and through childhood, their wait is a long one, usually from 10 to 14 years. So, at puberty, the anterior pituitary gland begins to release FSH, or the follicle stimulating hormone, which stimulates a small number of primary follicles to grow and mature each month, and ovulation begins to occur each month. These cyclic changes that occur monthly in the ovary constitute the ovarian cycle. At puberty, perhaps 300,000 oocytes remain, and beginning at this time, a small number of oocytes are activated each month. As the productive life of female is about 40 years, from the age of 11 to approximately 51, and there is typically one ovulation event per month. Fewer than 500 ova out of the potential 300,000 are released during her lifetime again. Again, nature has provided us with a generous oversupply of sex cells. As a follicle pruded by FSH, or the follicle stimulating hormone grows larger, it accumulates fluid in the central chamber called the antrum. And the primary oocyte, it contains replicates its chromosomes and begins meiosis. The first meiotic division produces two cells that are very dissimilar in size. The larger cell is secondary oocytes and the other very tiny cell is a polar body. By the time a follicle has ripened to the mature or vesicular follicle stage, it contains secondary oocytes and protrudes from the external surface of the ovary. Follicle development to this stage takes about 14 days and ovulation of secondary oocytes occurs at just about the time response by the burst-like release of a second anterior pituitary hormone. Luteinizing hormone, the ovulated secondary oocyte is still surrounded by its follicle cell capsules, now called corona radiata, or radiating crown. Some women experience a twinge of abdominal pain and the lower abdomen when ovulation occurs. This phenomenon called Metallsmerz, German for middle pain. It is caused by the intense stretching of the ovarian wall during ovulations. Of the cells, sperms are tiny and equipped with tails and locomotion. They have little nutrient containing cytoplasm, thus the nutrients. Okay. So the hormone reproduction by the ovaries. As the ovaries become active at puberty and start to produce oocytes, there also begins uh, to produce ovarian hormones. The follicle cells of growing and mature follicles produce estrogens, which cause the appearance of secondary sex characteristics in the young woman, such as changes include the following. The first is enlargement of the accessory organs of the female reproductive system are the uterine tubes, uterus, vagina, external genitals. Next is development of the breast. Next, appearance of axillary and pubic hair. Increase the deposits of fat beneath the skin in general and particularly in the hips and breast. Widening and lightening of the pelvis. And last, the onset of menses or the menstrual cycle. Estrogen also has metabolic effects. For example, it helps maintain low total blood cholesterol levels and a high HDL level and facilitates calcium ion uptake, which sustain bone density. A second ovarian hormone, progesterone, is produced by the glandular corpus luteum. As mentioned earlier, after ovulation occurs, the ruptured follicle is converted to the corpus luteum, which looks and acts completely different from the growing of and mature follicle. Once formed, the corpus luteum produces progesterone. As long as LH is still present in the blood, generally speaking, the corpus luteum stops producing hormones by 10 to 14 days after the ovulation. Except for the working with estrogens to establish the menstrual cycle, so progesterone does not contribute to the appearance of secondary sex characteristics. Its other major effects are exerted during pregnancy, when it helps to maintain the pregnancy and prepare the breast for milk production. However, the source of progesterone during pregnancy is the placenta, not the ovaries. So, uterine or the menstrual cycle. Although the young embryo implants and develops in the uterus, this organ is receptive to implantation only for a very short period, which um, each month. Not surprisingly, this brief interval coincides exactly with the time when fertilized eggs would begin to implant approximately 7 days after ovulation. The uterine cycle or menstrual cycle is a series of cyclic changes that the endometrium or mucosa of uterus goes through each month as it responds to changing blood levels of ovarian hormones. The cyclic production of estrogens and progesterone by the ovaries is in turn regulated by anterior pituitary gonadotropic hormones. FSH and LH. It is important to understand how these hormonal pieces fit together. Generally speaking, both female cycles, the ovarian and uterine cycles, are about 28 days long. Ovulation typically occurs midway in the cycles. On or about day 14 illustrates the events of the ovarian cycle and the uterine cycle at the same time. So the three phases of menstrual cycles are as follows. So days 1 to 5 are the menstrual phase. During this interval, the superficial functional layer of the thick endometrial lining of uterus is sloughing off or detaching from the uterine wall. So the detached tissues and blood pass through the vagina as menstrual flow. The period for 3 to 5 days, the average blood loss during this period is 50 to 150 ml or about 1/4 to 1/2 cup. By day 5, growing ovarian follicles are beginning to produce more estrogens. Next is day 6 to 14 or proliferative phase. Stimulated by a rising level of estrogens produced by the growing follicles of ovaries, the basal layer of endometrium regenerates the functional layer of glands from it, and the endometrial blood supply increases. The endometrium once again becomes velvety, thick, and well vascularized, or ovulation occurs in the ovary at the end of this stage in response to the sudden surge of LH in the blood. So days 15 to 28, the secretory phase. A rising level of progesterone production by the corpus luteum acts the estrogen prime endometrium and increase its blood supply even more. Progesterone also causes the endometrial glands to grow and begin secreting nutrients into the uterine cavity. These nutrients will sustain a developing embryo if one is present until it has implanted. If fertilization does not occur, the embryo produces a hormone very similar to LH that causes the corpus luteum to continue producing its hormones. So, if fertilization does not occur, the corpus luteum begins to uh, regenerate toward the end of this period and LH blood levels declines. Lack of ovarian hormones in the blood causes a blood vessel supplying the functional layer of endometrium to go into spasms and kink when deprived of oxygen and nutrients. Those endometrial cells begin to die, which sets the stage for the menses to begin again on 28 days. Although this explanation assumes a classic 28-day cycle, the length of the menstrual cycle is quite variable. It can be as short as 21 days or as long as 4 days. Only one interval is fairly constant in females. The time from ovulation to the beginning of menses is almost always 14 to 15 days. So, next is the mammary glands. Mammary glands are present in both sexes, but they normally function only on women. Because the biological role of the mammary glands is to produce milk to nourish a newborn baby, they are actually important only when reproduction has already been accomplished. Stimulation by female sex hormones, especially estrogens, cause the female mammary glands to increase in size at puberty. The mammary glands are modified sweat glands that are part of the skin. Each mammary gland is contained within a rounded skin-covered breast anterior to the pectoral muscles, slightly inferior in the center of each breast is a pigmented area, the areola, which surrounds the central protruding nipple. So the internally, each mammary gland consists of 15 to 25 lobes that radiate around the nipple. The lobes are padded and separated from one another by connective tissue and fat. Within each lobe are smaller chambers called lobules, which contain clusters of alveolar glands that produce milk when a woman is lactating or producing milk. Milk produced by the alveolar glands exits each lobule by passing into lactiferous ducts, which open to the outside at the nipple just deep to the areola. Each duct has a dilated region called lactiferous sinus, where milk accumulates during nursing. Uh, so, so homeostatic imbalance for these female reproductive system is the breast cancer. Breast cancer is the second most common cause of death in American women. One woman in eight will develop this condition. Some 10% of breast cancer stem from hereditary defects, and half of these can be traced to dangerous mutation in pair of genes. 50 to 80% of women um, who carry the altered gene develop breast cancer. With the possible exception of family history, most risk factors reflect lifelong exposure to estrogens or early menses, late menopause, estrogen replacement therapy, and others. So, breast cancer is often signaled by a change in skin texture, puckering, leakage from the nipple. Early detection by breast self examination and mammography is unquestionably the best way to increase a woman's chances of surviving breast cancer, because most of breast lumps are discovered by women themselves in routine monthly breast exams. This simple examination should be a priority in every woman's life. Currently, the American Cancer Society recommends scheduling mammography X-ray examination that detects breast cancers too small to feel, less than 1 centimeter yearly for women between 45 to 54 years old, and every 2 years thereafter of the results are normal. So that would be all. Thank you.